You're going now, Doc. Morning. Tell us what is happening out here this morning.
My name is Dr. Ford from the Jackson Public Hospital. Right now, as you can see, they lock out all the healthcare workers because we have taken our right not to be vaccinated, just as other people have taken their right to be vaccinated. And what they're saying to us is that if we cannot provide a vaccination card or a negative COVID-19 test, we cannot enter into the compound. The compound that we've been working at all through the pandemic, they say we cannot go into now. We turn up for work diligently just as every morning we did, and we've been denied access because we've been discriminated against. A matter of fact, because we do not have a vaccination card. Because the science show that the unvaccinated persons and vaccinated persons are carrying the virus just as equally as one another. So why is it they're locking people outside the compound? A matter of fact, we're not opposed to other persons being vaccinated. We're not opposed to the government going for herd immunity. But what we're saying that the manner in which they're doing it, taking all the practices from France and Europe and all these things, the manner in which they're doing it is illegal. Because just locking out healthcare workers is a violation of the Essential Services Act, Article 12. It says you cannot lock out a healthcare worker, neither the healthcare worker cannot strike, just like that. So why are they locking us out? That's in violation of the laws. The Occupational Safety and Health law said that if the workplace requires you to take a test, as they're requiring us to take a COVID-19 test, they have to foot the cost of it, not the worker have to foot the cost of it. The Medical Practitioner Act says that every person has the right to be informed, and if they're in their right mind, not under duress, they got the right to consent or to reject any medication. That's why none of these nurses can't give nobody medication without their consent. And we're utilizing the same right that people been utilizing all the time. We're not opposed to vaccination or to herd immunity and all these things, but the manner they're going about doing it is totally illegal. And we're not going to stand for that. There's discrimination to lock out people outside or the workplace. And nobody should stand for it. Nobody in this country should stand for it. We should protest this type of imposition, this type of coercion against people. And we stand with the workers everywhere around this country, in Linden, in Berbice, everywhere that choose to stand up for their right. They even going as far as locking out people from the public service. If you go to GRA, you can't even pay your taxes, you can't even do your business. Old people getting locked out of NIS. They can't get the pension. Earlier they were locking out patients from the hospital, sick people from the hospital. Getting torn back. You come here with your disease, your diabetes, your hypertension, heart failure, and they turn your back. Essentially, what you call that? What is that? It's bullyism. So we are taking a stand against imposition of vaccine and coercion.
Good. 64 to 57. Like you all look like cannibals.
Good morning and greetings. Actually, how are you doing? Good morning. I'm here standing at the Linden Hospital Complex just to give you a report as to what is to some extent already known, and that is that healthcare workers for the 7 a.m. shift have been locked out. These are nurses. I haven't seen any doctor yet. And it's obvious that the decision maker in this whole scenario, Frank Anthony, or the face of this issue, does not intend to do differently. And yet again, he's intending to cause severe issues in our healthcare sector. But before I proceed, I just want to know whether you can hear. You can let the camera person know whether you can hear clearly, you can see clearly, so that we can have an idea as to how well the quality of the connection is. And thereafter, I'll continue to speak. Can you hear clearly and can you see clearly? Is it good? Okay, so while we're doing that, the nurses are sitting, some of them have dispersed a bit, and they're, I guess, going around for shade in certain different areas. But our nurses are locked out of this hospital. There are police officers who are, is it quality fine? Yes. Okay. Police officers are manning the gates. I guess, again, it's either they are sent, is their assignment, is their duty. They don't come and do these things on their own. So it seems as if the government is intending to challenge or to really provoke a reaction from citizens that they can justify whatever they do afterwards. This is a day in which our town, in which our region, in which our country is being held hostage by decision makers who are too weak to stand for what is principled and what is right. I maintain that even in the most gruesome battles in war, you are not permitted in any way to do this to a healthcare system. This time around, I'm standing here and I'm calling on the union representing these nurses to do that which makes you strong. To do that which is only right by the people who pay their union dues. Every month is deducted from their salary. You need to do the right thing. This country is in a perfect position to demonstrate to this government and anyone who will come in the future that we are prepared as citizens to tell politicians that you serve us, we don't serve you. You do what we want. We don't bow to you. Go ahead, that's fine. We don't bow to you. We do not bow to you. We do not subscribe to your dictatorial, chauvinistic behavior. But I'm calling on every person in this nation who is affected by this to understand the power of patience, to understand the power of strategizing before you act. Many people want an on-the-spot, right now result. It doesn't work like that. It doesn't, bless you, but it doesn't, shalom. It doesn't work like that. You must be prepared for the long haul with this, because at the end of the road, we will always win. The union must represent the healthcare workers. This is not a question of waiting for anything here. The union must represent the healthcare workers in this nation, because the union is aware of the number of laws, especially surrounding the healthcare sector, that are being broken by this government. You cannot under any circumstance deny an individual, firstly, the right to medical attention. No government, no president can do that. That's a crime against humanity. And this government is bent. It's their nature to do these things, because I told you all, did I not tell you since election time? It's come back to haunt you now. I told you that any politician that you sit and allow to violate the Constitution to get into power will not respect it afterwards. I told you that. Both sides of the fence, up and be civic. If they cannot treat the law with regard, then they'll always create a lawless society. This government is obviously intending to prove to Guyanese that they have it their way. It is not the people's way, it's their way. But I'm here with hope, with great hope, that there will be a day I don't mind how long it takes, that this government right here and you involved will learn that the people rule Guyana. And you will learn that you are there because of people in Guyana. Not everyone, but some. I'm going as far as to call on the army. I don't expect you to act, but I'm still calling on you to observe that which you are supposed to do. You can see as military people the direction in which this country is headed. And it will be most unfortunate for you to be participants in it because of the top bracket of the army, maybe positioned to act in the interest of a government and other people, not the sovereignty of a state, not the well-being of a state. No one is supposed to sit in this country and watch a government totally destroy and disregard the ambit of law and the edicts that govern all of us. We can't, this is almost unthinkable. You cannot deny an individual the right to medical attention. It cannot be justified under any circumstance. Whether they have a mask, whether they do not have a mask, whether they're vaccinated, whether they are crazy, you cannot deny an individual the right to medical attention. But this Pacific administration is proving to us that they're prepared to do that as well. Of course, under international law, you cannot force an individual to receive anything they do not want in their body, any form of medication. If a doctor says that you have cancer and they have to remove probably one of your lungs, or they have to remove some part of your body, listen to me here. Even if the doctor tells you that the cancer is life-threatening, you're going to die, you have a right to say, no, leave me alone. And they cannot force you to cut your body open. The government can't say, well, we care about you, we care about your health, you have to go and receive a surgery. Because you have to give consent for any medical procedure to be done on you, including vaccination. Now, I'm aware that the argument will be raised that the vaccination is to protect everybody, and so it is different from having an ailment where you're alone, like cancer, you're affected. But the international law doesn't state that the government has a right to overrule the right to my body that's given to me and the right for me to consent before you give me anything, and that you must never force me to participate in any medical experiment or anything along the line that these vaccines and these injections have taken. So to say that it is my responsibility to protect another person, hence I should receive a vaccine, is bunkum, because you're denying and defying the laws of science, which I will repeat, so that the Minister of Health, as he's called, can know that people in this nation are not daft. Based on the medical definition of vaccines, you cannot tell me ever scientifically that someone who has a vaccine is less protected than one who doesn't. And someone who has a vaccine is threatened by someone who doesn't have it. That is absolute nonsense. And I've lived to see that this nation is governed by people outside of it who have agendas that do not have Guyana's interests at heart. And I'm seeing that we have politicians in this land who prepare to bow to external agendas so the positions can be secure. But the people are coming, and the people are going to arise in this nation to recognize how much authority we have, and we're going to exercise it. The nurses, I say again, are out. The guards are manning the gate. Some of them have left. The police officers are here just in case people come to the gate, I would like to think, demanding for them to be open. Every public health worker should understand the severity of the situation. Patients are in the hospitals without adequate staffing to cater to them. That is a crime. This government is committing a crime against humanity. There is no international law, there is no law anywhere at the UN level that says that you have the right to prevent healthcare workers from taking care of patients. And I'm standing off from the nurses today for a reason. Because I want you all to understand that your union must, at this time, represent you. I'm told that this, I can see actually I have footage that is happening in Georgetown, it's in the news. I have no footage of Region 6 so far.
Someone said there's 6 hospitals in Berbice and all nurses are on duty.
There's 6 where?
In Berbice.
6 hospitals?
All nurses are on duty.
Somebody said there's 6 hospitals in Berbice and all of the nurses are on duty. That is where we're going to speak to the government and demonstrate that you are discriminating. If that's the case, I want to verify that so. But if that's the case, it's a clear-cut, undeniable fact that you are discriminating against certain regions. Region 10 has voted overwhelmingly for APNU AFC. Region 4 always votes for APNU, or PNC and APNU. So what have you done? The 2 regions that we see so far, Region 4 and Region 10, we're waiting to see what happens in Region 6. We are waiting to see what you're doing about the 6 hospitals in Region 6. I'm waiting to see what happens at Skeldon. What is happening at, hey brother, what's happening at Port Morant? What's happening in New Amsterdam? We need to see. If somebody's in that region and you can drive around with a camera or a phone, please provide footage where we can see that Skeldon Hospital, for example, has people working all the time. Drive to Port Morant and those places. Let us have hardcore video evidence so they won't say that to be lying. You have to deal with these people based on hardcore evidence. Irrefutable evidence. If you can provide a video footage, not a photograph, even if just a 5-second video, showing that the hospitals in Berbice are open, the gates are open, nurses walking in and out, people walking in and out, let us see it. Somebody in West Demerara, Region 3, minibus drivers, if you can drive over there, or whoever you can, let's get a video of Region 3, Irfan Ali's region, and let us see if they're locking nurses out of there and healthcare workers and everything, because you can't tell me that all of the hospitals in Berbice, in Region 6, would have 100% vaccinated staff. You can't tell me that. You cannot convince us about that. This is the time for the people to stand. This is the time for the people of Guyana to stand as a people. Because it's a system that's designed to destroy your rights. Do you know somebody with a relative in this hospital will feel today if they cannot visit a person and now they realize nurses are outside and cannot take care of the person? Are you as a government seeking to intensify your attack on us as people? I say to my fellow Londoners again, this time I would not advise you to hinder or affect your own development and your mobility. Any bridge blocking, let them block Berbice Bridge, let them block Demerara Harbour Bridge. Let's see if they have courage like we do. Because Region 4 is now on the firing line. Region 4 is now being shown at the largest health facility in this nation, the Georgetown Public Hospital Corporation. This government is prepared to shut that down so that they can have their way. We must be willing to stand. We have to be courageous. We have to be strong. And we have to be patient. They've broken the law about people seeking health care. They've broken the law about persons who are in the healthcare facility and sector being allowed to cater to patients. You cannot deny doctors the right to take care of patients. Show me that in the law, Frank Anthony. Show me that in the law, Mr. Nandalal. Show us it. If you give us law, I told you I'm a law-abiding person. If you show me law, I don't argue against law. Show me in the law where a doctor or a group of doctors, nurses and other people do not have the right to take care of patients because they're not vaccinated. Do you realize that these are medical professionals here who are trained, and they're saying that they have the right to determine what enters their body because they've been trained in law. They've been trained in medical protocols. They understand that which is acceptable and that which is unacceptable according to law. You cannot, under any circumstance, bully individuals like this and think it's justifiable. We have to stand. And I say again, today's not them standing in a crowd or anything like that. Today is for me to stand as an individual as it started, because this government is going to hear from a person who has no political party to stand beside or to represent. I don't need a crowd to represent. I'm standing here alone under this tent because that's where I want to be. Show us Department of Information, DPI, you show us. Travel around Guyana and you show us. You have agents all around the place. You show us evidence that in Berbice this is being done at the hospitals. Show us in Region 6. Show us that this is being done in areas that has government support or vote for the government. Show us that. So somebody is saying here that there's no nurse inside to take care of anybody. There's a patient coming out here. You can just show him, not zoom in. But there's a patient coming out here who's asked the security for help because the nurses aren't in there to take care of him. You don't understand the inconveniences government is causing and the chaos you're going to create with your foolishness. How could this be acceptable? A man is there begging for a nurse to come and take care of him. That's what I'm talking about. People could have had surgery and they need dressing. No nurse is there to take care of them. And your caring government is doing this to you all. The people need medical attention. The people are asking for attention. You are inhumane. This is a direct attack on Guyanese by a government. And it seems as if whenever I stand there, I'm fortunate or unfortunate to see these things happen. Imagine a patient is coming to a gate to ask if a nurse could go and take care of him. And you all don't see this as a crisis? As a crisis? You don't understand what you're doing to your own people? A patient is asking if a nurse can go to take care of him because he has to be dressed. His dressing has to be taken care of. I am hoping, and I don't know if I'll have the chance, but I'm hoping that one day I could be vested with the authority to deal with these people in a legal framework, because you all need to be tried for crimes against human beings. You need to be held accountable for doing that which is an attack on your own people. How can Frank Anthony justify what we're seeing here? A patient has to leave the accident emergency area to come and ask if the security please send nurses in to take care of him. How can you justify that? Give me one justifiable reason for doing that to people. And then brand it as being human and humane. Justify doing that to people. How can you have a patient having to come to a gate to ask if a nurse can go to take care of his injured leg? Can we justify that? Can we honestly say that that is decent? Does it fall under the auspices and the umbrella of health care? When have you ever seen patients in Guyana having to come to a gate to ask security if they could please send a nurse to take care of them? What manner of craziness is this?
For the camera to be moved.
Move where?
I guess they want to see the
Persons want to see the nurses.
they're sitting underneath the.
All right, let's go since viewers want to see. Morning. This is unjust. This is injustice to our people. How are you doing? The persons locked out, the children here. Y'all came for healthcare as well? Okay. Morning. The nurses, some of them have left, but nurses are here. Healthcare workers are outside. They can't get in. People are here asking if they could please have a chance to be treated. And they're out. It is worse at Georgetown Hospital. How could this be right? What justification can any Minister of Health have for having a patient have to come to ask if nurse are going to take care of him? Can you justify that? Under any law? How can that be justifiable? If someone had surgery yesterday and they have to be treated today, how can you justify that there is no nurse available to have that person catered to? This is gross injustice.
So, Mr. London, what are the plans next?
My plan is to continue to stand where I stand and continue to speak on behalf of those who are not speaking for themselves, and continue to advocate for the government to make a sensible decision. We have been through the worst thus far of these infections, and people are still here. They're still living. There has to be a reversal of this because it's affecting people in ways that are beyond, apparently, the understanding of the administration. This is gross injustice. This is a crime against human beings. There is no way that you should have patients having to ask if a nurse can go to take care of them. And the nurses can't go to take care of the patient because there's some order given. And a gate is locked. How much more will you do to your own people? Justice has to be served. This is gross injustice. And then for police officers to be given instructions as they would have to be given to come and man a gate and watch the gate, for it to appear as if, okay, then the police are here to enforce the law. The law says people must have health care. So how you want to just set police up now to say, okay, then the police are here. If people try to open the gate, the police will stop them. Says the police is the problem? They are law enforcement officers, and the law is that you cannot deny a Guyanese the right to health care. So which law they must uphold? Which law must the police stand on? The side of the law that says no Guyanese, including them, must be denied health care, or the law that says you could break it? And you could just decide now, okay then, because people aren't taking a vaccine, lock them out to the hospital. Lock out the nurses, lock out the patient, lock out everybody.
So, for example, if someone will be coming here right now, they're injured, they're accident, what would happen then?
Well, they're saying that those who are injured and need emergency can go in. But the unthinkable is that those who need medical aid can go in. Those who offer the assistance are locked out. So it seems as if the reasoning is that as long as you can access or you can walk through the gate if you're injured, or be taken to the gate, and you're taken to the accident emergency department, then justice has been done to you or you've had service rendered. And there's no nurse to take care of you. And I would like to know that if patients begin to die in Linden or die at Georgetown Hospital, who is responsible? Can Mr. Anil Nandalal, the Minister of Legal Affairs, inform us of that? If Frank Anthony makes an order and they lock the nurses out of the hospital and somebody needs attention and they die, who is responsible? I'll tell you what this government will say, that the nurses are responsible because they didn't take vaccines. I know you all well. I know you people very well. You have the gall to say that if the nurses were vaccinated, then the patients would have lived. That's how you all process. That's the depth to which you can sink regarding humanity. Tell us who's responsible. There are certain frontline faces, as they were called, frontline workers. I remember them from when the news was every minute at the hospital showing what happened to patients. And those same doctors, some of them are now out of the gate at Georgetown. Same people. So they were good enough without any vaccine, without any established treatment, to try the best they could to keep people alive. And they succeeded. Because out of over almost by now 27,000 cases or so, we have got 600 deaths. If those doctors didn't work the way they had to work, it could have been worse. Most definitely worse. We have a doctor in Linden who was manning the COVID center without vaccines. And that man put his life on the line consistently and saved many lives. But if he were not vaccinated, the possibility exists today that Frank Anthony would lock him out too. There has to be a reaction from the unions in Guyana that show these healthcare workers that you're all serious. I'm here to say live on this broadcast that this is the perfect opportunity for every union with sense to go on a nationwide strike. Withhold your services and let this government show you that they could do what your workers can do. There are tens of thousands of workers in this nation. Call them off the jobs because you're not helping the cause. And speaking to the unions in the private sector, you are not helping the cause. How could you people sit and watch this happen to your employees, to your workers? Who pay you all to represent them? This is a perfect time for every part of this nation, in reference to the public sector, to be shut down. If you see the path to victory, take it. And the path to victory is not sitting around and mumbling all the time as a union and issue statements here and there. The path to victory is to act. Call all of your workers off of the job. You have to take a stand. And this government cannot deal with all of the public sector, most of the private sector, having employees off the job. They can't handle that for 3 days, I promise you that. Maximum maybe 4. Because systems will shut down across this nation. To the nurses who are here and others, and those who follow me live, there are certain meetings I know will be had. The unions will meet, the unions will decide as to what they're going to do. They have to do that. So give them time today. Don't rush today. Please don't rush the process. Give them time to act. They have to have certain meetings made. By right, they have to engage the various entities that are affecting the staff or causing the grief to the staff and workers. And once they engage them and give them a chance to fix it, and they don't fix it, then they have a right to call industrial action. So don't rush the process. They can't get it today and say strike right now. It doesn't work like that. They should engage the authorities, let the authorities know of the grievance of the workers. Let the authorities know the union's position in these matters. And once the union put a position on the table, and the authorities do not respect the workers' interest, then the union has a right. So I'm asking you to be patient in this process. Don't rush it. Don't rush the process.
Will you find jobs for them?
What's that?
Will you find jobs for them?
No, that person can find jobs for them because they don't understand what public sector is all about. A member of the public sector isn't fired by a hospital administrator. There's a public sector commission that deals with the employment of public servants in Guyana. And I want the person to also say, if they can, if any government can fire 60% of the staff in the public sector in this nation and survive. The people in Guyana are in a winning position if you understand your position in reference to who governs the nation, who has the power. So I came by here, want to stand as an individual with a serious concern, because the hospital in my region, the main hospital, the other one has been turned into a COVID center. This is the only hospital we have in Linden of this magnitude, and the staff are outside. This is a direct threat to my well-being as well if something happens to me. Again, I reiterate my call for the government to do that which is right and lawful. I am not asking you a favor. I'm reminding you of what is lawful. There's no please in my book here. I'm not asking you to say you have power to change your mind, so please consider. I'm not asking you anything. I'm saying to you that as a human being in this nation, as a citizen, I am requesting that you seek to abide by what is lawful. People, before I leave you, I don't know if some of y'all notice that for Region 10, for example, in Linden, they're showing where they're building 1,000 homes, 2-bedroom, whatever else they call it, flat houses and all that. And they're pouring foundation in the midst of a crisis where people are being affected and persons' jobs are being threatened. This administration wants to show you in the region that we're building houses. But let me make this clear for you. North Korea is a dictatorial state. They have houses there too. Iraq, they say, was led by a dictator. Germany was led by a dictator. And in all those nations where dictators lead people, they have infrastructural work done too. So don't think that because somebody's building a road in your area or they're building houses in your area, it means that they have care for you. If you could lock a hospital gate, lock nurses out of hospital, and watch patients have to beg for treatment, houses don't count. Because you're doing this knowing that people could die at this hospital, and you don't care. So don't tell me building a house in Linden. If my people fall for this, you are just weak. And you deserve no respect from this government. This is not about building no house and road here. You have people in this hospital whose lives are threatened because nurses are outside. And the best news could report that people pouring foundation for houses in Amelia's ward. That's how disrespectful this administration is to us as a people. You can't dangle things in our faces, because if I ask you now, who got a contract to build those houses, you can't answer me straight. And tell us how they got the contract. I'm calling on the unions today. Hopefully by tonight you'll issue a statement as a union for these nurses here and these healthcare workers. You'll issue a statement that gives them direction as to the way forward. I'm calling on Lindeners to be patient. Let us see what happens in Region 6. Let's see what happens in Region 3. Let's see what happens in Region 1. Let's observe carefully how they behave with certain regions. Because this time we're taking note and we're keeping record. I hope that I can make my way to the city at some point to stand with those nurses and healthcare workers as well. Because all across this nation, people must know that we stand for them. And when they begin to stand for themselves, we stand with them. We're grateful. So I'll close the broadcast now until I return later on. And thank you so much for the interest you're showing in what's happening in this country. Those of you who are overseas, I know certain members of APNO overseas still with you all. Just tell them the Guyana is disintegrating, please. So maybe they could bring their flight forward. Or whatever they have to do. Because we aren't seeing certain faces on the street right now. So let them know that their people need assistance. But I thank you. And hope to speak to you again soon, before the day is over.